Hello, good afternoon. Thanks very much for joining me. My name is Michelle Moser, and I'm here to talk a little bit about gut health and inflammation as it pertains to remedies, functional medicine, and different specialty areas that it can affect. I am a clinical liaison for Revelation Pharma Corporation and an LDN Master Specialist through the LDN Research Trust. I don't have any relevant information to disclose. This webinar is specifically for information purposes. It's not necessarily to provide advice nor diagnoses. And we will talk about off-label information regarding low-dose naltrexone, as well as other remedies, and compounded medications are not evaluated by the FDA. So quite honestly, this is a very large topic. It's one that we could literally spend days talking about. So I just want to hit the highlights. And of course, if you have any questions, you can always reach me personally through my email or my cell phone. I'd be more than happy to answer questions wherever necessary. But what is really important here is that we need to make sure that we're taking really good care of ourselves. Everything begins in the gut. Honestly, everything begins in the gut. Whatever happens in your gut affects your brain, affects your mood, it affects how your body works, how it doesn't work. It affects digestion. It affects pretty much all imbalances and balances. About 90% of serotonin is made in our gut. So if our gut isn't healthy and happy, then we won't be either. And of course, our immune system is primarily built in the digestive system as well. So we want to make sure that we have a very robust immune system, not just today, but going forward, because we just never know what we're going to run into. Now, the gut really starts around the oral cavity as well as the nasal cavities. And there's a lot of things that we can see, especially when we take a look at what's in the gut. We can see transference of bacteria, fungus, yeast, virus from the oral cavity to the small intestine and further down. And that can have a very impactful, maybe what I want to say is a less than desirable impact on our overall health. Because the enzymes, the bacteriums, the viruses and that sort of thing that are in the mouth are not necessarily meant to transfer elsewhere, but they do that on occasion. It can affect metabolic balance. It can affect how we digest things, how we absorb our nutrients. So it's not more than just bad breath, gingivitis, tooth decay, plaque buildup. It all contributes back to cardiovascular health, complete oral health, and other health concerns as well. Of course, everything that we are wanting to absorb comes in through usually our mouth as we eat our foods, drink our fluids, other nutrients and supplements that we might take in. But of course, they need to go through the gut, be changed, hopefully to their active form, and then sent into the bloodstream after they're absorbed. The condition of the gut lining will absolutely determine what or will not be absorbed. And that can have a very large impact further down the line as to what are the cells going to say, whether they are going to receive the nutrients that they absolutely need. That can affect how we age, how we detoxify those toxins that are even breathed in or taken in orally or even through our skin. And certainly even our genetic predisposition as to whether or not we're going to take certain nutrients and convert them to either a methylated form, a sulfated form, or conjugate it somehow through the liver so that it can be further used and utilized by other tissues and cells in the body. And quite honestly, vitamins and supplements are not just an expensive way to supplement what we're doing. A lot of times they are key ingredients to what is missing or to enhance what is a deficiency. When we look at the connection between the microbiome and the brain, we can go back into the literature decades, if not maybe even 100 years or so. This has been studied for a very long period of time. It's not new science, but there is new science to show us exactly what the impact is and how we can make a difference, not just today, but even in the future. So if we make decisions for ourselves today, we can be perhaps healthier down the line. And I've noted a few citations here regarding what has been found, not just in certain branches of medicine that is being studied, but truly the basic concepts. For example, what happens with inflammation? How does inflammation in the gut then impact inflammation in the brain? And we see that from a wide variety of authors, that it really starts with the nutrition that we bring in, specifically what is gluten and casein or wheat, and a wide variety of other gluten-full grains, and also dairy products. What is that really doing to our body? And how is it changing not just the lining of the gut, but then when those toxins are absorbed, how are they affecting other areas that we want to protect to ensure overall health? We can see that even on occasion, pardon me, that we can see changes on MRI. And those are diagnostic tools that we use in a wide variety of ways and areas to determine what is going on. Because when we understand the metabolic pathways, then we can make decisions as to what medications to use or not use. We've also seen that gluten sensitivity not only affects the lining of the gut and even the brain, but definitely has an impact on thyroid and overall metabolic health. What we're also seeing a rise is a wide variety of autoimmune disease. About 40, 50 years ago, we really didn't have too many autoimmune issues. And today we have well over 100 autoimmune diseases. What we're seeing is that when there is a dysbiosis in the gut, that can a lot of times trigger a genetic SNP or a change that will lead to an autoimmune disease. So specifically, here is a citation that goes over how the pro-inflammatory cytokines are then elicited in a wide variety of autoimmune disease, such as rheumatoid arthritis, multiple sclerosis, Alzheimer's, Parkinson's, ALS, and even some mood disorders such as schizophrenia, where it can be an overexpression of a wide variety of cytokines. The reason why I bring this up, as well as tissue necrosing factor alpha, C-reactive proteins, the interleukins, wide variety of cytokines, but also the tissue necrosis factors, those are very important to remember when we further go through these slides, because we will circle back to how this will make an impact. When we're dealing with a wide variety of autoimmune diseases, we do have very specific treatments that can be used. One specifically is low-dose naltrexone. And behind me, you'll see several books that are now been published on low-dose naltrexone. And those books give a very deep insight, as well as a wide variety of scientific notations and case studies to further explain the idiosyncrasies behind not only autoimmune disease, but how low-dose naltrexone can definitely affect those, and not only affect them to better a patient's symptom list or to change their outlook on life, but truly can improve their lives to the point where they don't feel that they have the disease any longer. But what we do know about low-dose naltrexone is that doses need to be very specific and specialized to that individual. We need to start low and go slow and slowly increase the dose. And not everyone responds to low-dose naltrexone, but when we do start low and go slow, we can capture about an 85% effectiveness rate. Now, the 85% effectiveness rate is something that has been shown over several compounding pharmacies over across the United States. We do need to pay attention to what's going on with the patient's symptoms. So there are some monitoring tools that are available, both in paper format and electronic format, that can then help determine the lowest effective dose. There's a wide variety of forms, dosage forms, that are available in a compounded low-dose naltrexone. And again, those are available primarily to suit the needs of the individual patient. Not everyone is going to do well on a capsule. Others might do better on a liquid. And if we're dealing with younger people, perhaps we need to use a transdermal gel. Topical products are usually not substituted for an oral dosage form, but can be used adjunctively with a oral dosage form as well. And again, less is more with this medication. So we try to narrow down exactly what is necessary for that patient to provide best patient outcomes. There are a couple of new words in the last decade or so that have been thrown around, the GeroBiome and GeroBiotics. And the reason why these are coming up even more frequently is because we're paying a lot of attention to how someone ages. Now, we understand that either with the molecular and the cellular mechanisms of aging, this is a new scientific field that is starting to really bloom and blossom. And it goes back to exactly what is happening at the mitochondria at the cellular level. We can recognize a wide variety of biomarkers and target those areas so that we can not only improve health now, but improve healthy aging and even longevity. All of this goes back to identifying a wide variety of common diseases that are not only acute, but in chronically diagnosed as people age. So what we need to do is really understand what is going on with that individual in front of us. So it's important to test. We can guess and guess and guess, but we're probably going to get that wrong. However, we can formulate a really good strategic plan on how to treat the individual in front of us by understanding metabolically what is happening. Micronutrient testing is a wonderful way to understand what exactly is happening at the cellular level. It's rather difficult to tissue sample to realize what's going on. But when we look at micronutrient testing, we can then use that information to see chronologically, is that person aging the same way that their cells are aging? So they might be chronologically 50 years old, but their cells may actually show that they are much older than that or even younger than that. We can produce a wide variety of nutrients and even compounded medications to then further treat that patient to enhance their outcomes by supplying what is deficient or even absent. Very specific, micronutrient deficiency symptoms manifest is in subtle areas such as chronic fatigue. Everybody's a little bit tired all the time, but we see that a lot. And that is a very common symptom that people have on their lists. They're not necessarily a symptom that's specific to one age group or even a gender group. However, we can also take a look at acute issues, such as someone has an accident and they break a bone. If they are micronutriently sufficient, then we can actually see quicker healing, stronger bone formation, and better tissue repair. However, there's also a silent case of micronutrient deficiency, such as tumor growth. And we can use low-dose naltrexone to many times shrink, if not obliterate, those tumors as well, because low-dose naltrexone does trigger the opiate growth factors and the other tumor growth factors as well. But there's also an intense micronutrient deficiency that shows up in a wide variety of migraine headaches. And these are just a few examples that do relate to a wide variety of patients that show up at the office on any given day. So when we understand what's happening, we can replace and repair, and someone can actually feel better going forward. This is also a way to really rebalance the gut so that we can take a look at a biome assay, such as the BiomeFX genomic testing. Now, that's a complete DNA sequencing of exactly what is going on in the gut. It takes a look at the families and the different phylums that are there as well as comparing it to the average individual in the US. It also will then identify some of those nutrients that are deficient further down the GI tract. It measures more than 20 functions and a wide variety of microbiome and microbes, whether they are bacterium, virus, fungus, yeast. And it can really enhance the ability for one to participate in their own healthcare and make a difference quickly by evaluating what's going on and making changes and better choices for themselves. So a wide variety of patients are going to do better and have more successful outcomes if they're able to participate in their care one-on-one. Now, of course, it's going on in their body, but many patients actually want a more active role in that. Showing someone a 20+ page color report of what is going on. And oh, by the way, there's a reason why your A1C is not coming down. It's actually because of this type of food or that type of food or that nutrient that is deficient, or perhaps there is a bacterium that is deficient. However, it can be changed by making these other choices. It can also identify, is the body expending too much energy and converting even complex carbohydrates into simple sugars just because of a genetic or a metabolic predisposition. Of course, anytime that we understand genetics, that's also very helpful. 3x4 Genetics is a company that can send out a quick little cheek swab, comes back into a report that takes a look at everything from how well is someone metabolizing caffeine, how well do they do with salt, what types of exercise are best for that individual, and what is going on with their internal organ health, even their brain health, their estrobolome, so what is happening with their estrogen balance or hormone balance. It does give a little bit of a clue with thyroid balance as well. And then it's very easy for a provider to provide this test, comes back to them with a consult that's a very easy follow-up, and also then help that person on their healthcare journey. Of course, we can't forget digestive enzymes. So anytime that we're dealing with a gut, even an aging gut, a lot of times there's going to be a variety of digestive enzymes that will be low in concentration or even absent. Of course, almost every American has a little bit of stress going on. Those last 3 years have been a little bit challenging for most people. So stress, whether it's a worry, a metabolic stress, such as an illness or a broken bone or a surgical repair, or even just a worry, there's a wide variety of categories of stress. However, the body will react to those exactly the same way. It doesn't necessarily understand that there is not a lion in front of us that is about to eat us. We do need the energy to perhaps run away from a lion, but most of the time it's not the lion that's in front of us. It's a car that is just all of a sudden stopped in front of us and we've had to slam on the brakes. So it's a way for that fight or flight process that's absolutely necessary for our individual needs, but how our body reacts to it at that point in time with acute stress versus chronic stress definitely impacts the gut enzymes, as well as overall health. Gut enzymes, digestive enzymes can reduce a wide variety of inflammation, not just in the digestive system, but also elsewhere in the body. It can also improve immune response, and it can help to balance the microbiome, as well as nutrient assimilation. With all of that in check, we will see an increase in energy and a reduction in autoimmunity, but an increase in overall health, including how we appear with our skin and our tissues. So the skin on the inside, actually, in my professional opinions, even more important than the skin on the outside. Yes, this is how we go about our everyday. But the skin on the inside of the digestive tract is super important and is very easily changed because it's only one cell thickness deep. Therefore, if it is disrupted because of a lack of nutrients, a change in the microbiome, maybe it's a hormone issue, maybe it's inflammation because we keep eating things that we're allergic to and we're not aware of that. Perhaps it's even an exposure to chemicals and toxins. Anytime there's a disruption there, we're going to have digestive issues. That's going to lead to an impaired immune system, perhaps issues that come up that are labeled autoimmune, but that can also affect our brain and overall health. So when we're dealing specifically with functional medicine approach, sometimes we have to really break down the biofilm that is perhaps formed due to a wide variety of chemicals, toxins, inflammation, medications, dehydration, other intolerances that are there as well. And of course, all of this starts in our nose and our mouth, communicates with the inside of the ear, our lacrimal ducts in our eye, and then continues down the esophagus into the stomach, then on to the small intestine and large intestine. But this can also affect urinary health, and sometimes we use that as kind of a side note, but it is clearly commonly seen that anytime our gut is disrupted, urinary health can be disrupted, and that can affect our mood as well. So a lot of questions come up. Well, what do we do about probiotics? Well, this is just a few probiotics that are available. There's a wide array of probiotics, and there are prebiotics, which are meant to feed the good guys so that the good guys can stick around, replicate, and take hold. So choosing a probiotic that's best for the patient is really in the hands of the provider, although a lot of patients are looking for probiotics on their own. And this is just a few. The probiotics that survive digestion tend to be more of a spore technology, which is a newer technology such as Megaspore. And that is a probiotic that we see people have a little bit more success with. Do you change the probiotic from time to time? Yes, that's very important, because if someone is taking too much, let's say Saccharomyces boulardii, because they believe there's a yeast, we don't want it to then push out some of the other good flora. We want to make sure that it's in a really good balance. Probiotics can help balance our ability to digest. Probiotics can reduce inflammation. It can actually appear on the skin much clearer. So a lot of times, even with teenagers and those with adult acne, by giving them a really good digestive probiotic, we can see a reduction in their acne flares by about 50%. Because everything that starts in the gut, if we have a leaky gut, can actually transverse the capillaries in the bloodstream and land up on the skin. So the skin can be, the external skin can be a key factor as to what's actually happening in the digestive system. Now, just because a probiotic's kept in the refrigerator doesn't necessarily mean that it's better than one that is not. It really depends on the technology in which that probiotic was formed. And some probiotics are actually grown on milk products. So we have to be careful of those if someone has a lactose deficiency or a lactose intolerance. So earlier, when I was talking a little bit about the biome and getting into some of the research behind what happens in the gut and how it relates to inflammatory markers, how cytokines are produced, and what happens with toll-like receptors and tissue necrosing factors. So those biologic markers are very interesting, because we do have a medication that can not only help reduce those areas, but can also help to reduce antibodies. And anytime we can reduce antibodies, we see better energy, a wide variety of symptoms disappear or lessen, and patients always much happier. We use low-dose naltrexone in a wide variety of doses, literally from 1 microgram up to about 9 milligrams. Most of the time it's dosed once a day, but it can be used twice a day. We also use microgram dosing for opiate addiction, whereas we use traditional doses of around 50 to 300 milligrams for alcohol addiction. Weight loss programs, there are some commercially available products that use naltrexone along with other medications to be marketed as a weight loss product. They are fairly successful with a diet plan as well. And of course, we usually fail our diet, so usually the weight comes back. But we have compounded low-dose naltrexone specifically for weight loss programs. But even very significant and life-changing autoimmune diseases such as alopecia, a wide variety of Hashimoto thyroiditis, osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and even chronic regional pain syndrome. So there's a wide variety of areas in the autoimmune world that we see low-dose naltrexone to be very successful. So some people will say, well, gosh, that's kind of a red flag that this one medication can actually help all of those areas. But as you recall, we were talking about the pro-inflammatory cytokines, and when a medication can actually target what's happening at the cellular level and change those to reduce the inflammatory markers, almost all disease and even cancer is associated with a pro-inflammatory condition. So anytime that we can reduce inflammation, we're going to have an impact on that overall disease state. So low-dose naltrexone is available through compounding pharmacies. They are available in tablets, capsules, sublingual drops, sublingual troches, transdermal gels, topical creams, and we will use a variety of dosing depending on what we're actually trying to target. So with those targeted areas, alcohol overuse syndrome, we're going to see it much higher, more traditional dosing at the 50 to 300 milligram. There is a commercially available 50 milligram tablet. It is generic, so it's going to vary plus or minus 10%, but we don't usually use the commercial tablets to compound with, primarily because those tablets are full of lactose and other fillers that we just don't want in our compounded product. Capsules are usually used with a variety of fillers, again, specific to the needs of the patient. When we're looking at neuroinflammation, depression, autoimmune issues, gastrointestinal issues such as Crohn's or ulcerative colitis, a wide variety of skin issues such as lichen planus, lichen sclerosis, we use usually a 0.1 milligram, which is considered a very low dose, up to about 9 milligrams. And we would slowly increase that dose over time. So there could be anywhere from 9 to even a dozen or more dosage changes over, let's say, a 2 to 3 month period of time, perhaps even longer. And the reason for that is because what we find with low-dose naltrexone is that less is actually more with this medication. So it's not about achieving a blood level. We're not looking at a steady state amount of this medication in the bloodstream at any given time. We're not wanting to saturate the body with this either, because it will actually lose its effectiveness. We use ultra low doses or microgram dosing to follow the Oxytocin study that was done several years ago at a major university that combined microgram dosing, 1 to 2 micrograms of naltrexone along with oxycodone to actually reduce the need and the habit of opiates. What we found since then is that if someone is on a wide variety of opiates, whether they're synthetic or natural, it really doesn't matter. But we can use ultra low dose to help systematically come down off of an immediate release opiate as we slowly increase the microgram dosing of the naltrexone. And it literally interchanges so that the patient can literally get rid of their opiate habit. It has been very successful over the last 5 to 10 years, and I hope it continues to be such. There is a documentary that's available on YouTube where the country of Norway in 2012 looked at low-dose naltrexone and its opiate-dependent population to make an impact on that. And that documentary is very interesting, and how they were rather successful in their prescribing as well as patient outcomes. And I think it was a tremendous way to do that. I hope we can do that here in the United States. We usually use nighttime dosing for this to enhance the upregulation of the endorphin receptors, which then helps with immune system balance, modulating the immune system, but also then helps to reduce inflammation over time. However, if someone is having a little bit of an issue with vivid dreams, perhaps if that is impacting their life to the point where they're not wanting to continue with that, then we can switch them to a daytime dose. And again, we would still use the same titration schedules. The primary side effects of low-dose naltrexone are vivid dreams, sometimes a little bit of sleeplessness, but they usually resolve within 5 to 7 days. And we do see a little bit of headache from time to time as well. We like to talk about the 4 L's of low-dose naltrexone. It really is very low risk. You can do very little harm with low-dose naltrexone. We can start someone on low-dose naltrexone, and if they just don't feel it's the right medication for them, or after a few months, if they're just not seeing the results that they would like to see, given realistic expectations, you can literally stop the medication without adverse effects. Has very few side effects, those that I just mentioned, such as insomnia, vivid dreams. And the vivid dreams are actually a way for us to understand that low-dose naltrexone is actually working. And what it does is it drops individuals into REM sleep. And a lot of people who have chronic pain, autoimmune issues, a lot of inflammation throughout the body due to diabetes or other metabolic conditions, usually they don't dream. So they might not be dropping into REM sleep. So if they do drop into REM sleep for the first time in a very long time, having dreams can kind of catch them off guard, and they're really not sure what to think of that. However, those issues tend to resolve. So we really do see very low side effects. There's also very few drug interactions. We do need to be a little bit more careful with the biologics, the synthetic biologics, because of how the biologics will modulate the immune system and how low-dose naltrexone will do the same. So we don't necessarily want an immune system to be overactive. So we need to be careful about the combination thereof. But once we find their happy dose, it is a very low dose. It's usually under 5 milligrams. The majority of people are at 4.5 or under. And if we haven't found their happy dose, as they slowly increase their dose over 9 weeks or so, we can literally stop, wash it out for a couple of weeks, and restart even lower. And a lot of times we see that the body remembers what it needs to do, because low-dose naltrexone doesn't cure anything. It simply tricks the body into working on its own natural endogenous pathways much more efficiently and effectively. About 50% of the patients with neuroinflammation show an impairment of health-related quality of life and exhibit depression-like and fatigue symptoms. Well, this is where low-dose naltrexone has been very helpful in this situation. Twice-a-day dosing can also treat an individual, especially with chronic pain. And those doses given in the morning and in the night are not necessarily equal. So a lot of times we will slowly increase one end of the day or the other. And like I said, a lot of times they're on a smaller dose at one end of the day versus the other. And that's quite all right. It's all about finding what's best for that individual. And finally, the last L is low-dose naltrexone really is low cost. It is very cost effective comparatively and is quite surprising for a lot of people. So when we're dealing with gut issues and gut impairment, whether it's a dysbiosis, we really cannot forget about the emotional wellness that we are all seeking at any given time, because that emotional wellness not only affects overall health, but how we perform at work. It is what happens to our behavior, how we interact with others. So that mind over body control is something that is usually started in the gut. It's really our second brain. Maybe it's our first brain, but it is very closely related. So case in point, Thanksgiving dinner is usually turkey, mashed potatoes, stuffing, gravy, cranberry sauce. Perhaps there's some rolls in there, maybe a salad, maybe some vegetable, but there's a lot of carbohydrate. We get very sleepy. Some people get grumpy when they get sleepy. The tryptophan from the turkey helps us make us sleepy. All of that can affect our overall behavior, all because of what we put in our gut and how that was then absorbed. So let's go back to stress. It really is the number one cause of loss of productive time. It's the number one killer. It's really associated with every other chronic disease state, whether it is an acute or a chronic issue. It just tends to be the American way of life, but it doesn't have to control us. And there's a wide variety of tests. There's salivary cortisol tests. There's a wide variety of ways to look at those C-reactive proteins and other inflammatory markers in blood and blood spot. We can even look at those in a dry urine assay. But once we get a handle on learning how to meditate, learning how to reduce our overall stress, finding our own, and being able to relax the mind and the body, we actually slow down the digestive system as well, so that it doesn't overproduce too much enzyme or too much acid in that specific area. Because stress can increase the cellular age, which can then produce accelerated aging on the outside. So we need to be mindful of what's going on, as well as how to control that. And a lot of times that mindfulness is being aware and then quieting that dull, low scream that's going on. There's other keys to success, and there's other ways to hack our happiness chemicals. So whether we are looking at dopamine, oxytocin, serotonin, the endorphins, this is again where sometimes medications can help with that. There's a wide variety of natural products as well. We can use amino acids to help reduce and enhance this. We can also compound oxytocin. We have found in the last few years that individuals who are experiencing grief, a loss of a job, loss of loved ones, loss of a living lifestyle, we can increase oxytocin not only by playing with a baby and a dog and holding and hugging other people, but we can also use this as a natural hormone, usually in a nasal spray, and that works incredibly well. But we can also take a look at ways to reward ourselves and to understand our mood, understand our digestion. So if we do eat foods that maybe we consider comfort foods, but are they necessarily the best for us day in and day out? And of course, how alcohol affects that. And then how to reduce that acute and or chronic pain by using some of the ways to upregulate the endorphin receptors by using either low-dose naltrexone or mild exercise, a wide variety of laughter, and being able to connect. Even eating dark chocolate is very helpful. But we need to set realistic expectations for ourselves, understand what kind of a timeline we're looking at so that we don't expect too much too soon. And of course, we all know it takes about 21 repetitions of a new activity to form a habit. And it's all about individualizing in that type of care so that the person that we are trying to help along the way is bought into their own success. As I mentioned, oxytocin is also known as the cuddle drug of the brain. It helps us feel connected. It is the natural hormone that is produced when a newborn baby is placed on mama's chest, and that connection, that bond that is then formed. And even through hugging, we can feel the oxytocin release. It's fairly quick. It doesn't last very long either, but it is a natural hormone. And like I said, we can combat that into a nasal spray. We don't necessarily use sublingual troches in that, because if we do have to apply any kind of heat to oxytocin, it will significantly decrease its effectiveness. And oxytocin does definitely helps with depression and libido. You know, we've had a wide variety of virtual teachers over the years, and I just wanted to say thank you for allowing me to be one of those. And if there's anything that I can do to help you along the way, you can reach me at a wide variety of areas. You can also find me at my email of mmoser@revcustomrx.com. This is my personal cell. You're welcome to use that at any time. I thank you very much for joining me. Please connect with me and have a lovely day. Take care.